कभी भी कहीं भी अपनी सेहत पर नियंत्रण रखें। globalmenswellness.com पर जाइए और आज ही अपनी मुफ्त ट्रायल शुरू करें। विशेषज्ञ स्तर के जवाब पाएं सेकंडों में, हफ्तों में नहीं, वो भी बिना खर्च, बिना इंतजार और बिना असहज बातचीत के। आपकी शर्तों पर असली समर्थन। अभी globalmenswellness.com पर जाइए। Welcome to the Global Men's Wellness Podcast. In this episode, we're diving into one of the most innovative and talked about new areas in men's health. The use of intravenous, or IV, peptides and amino acids for treating erectile dysfunction. The rise of IV wellness clinics has put this method of delivery on the map for health and vitality. But beyond the hype, there is real, emerging science, looking at how this approach could revolutionize how we treat the root causes of ED. Today we'll separate the science from the speculation and explore what these molecules are, how they work, and what the future holds for this new therapeutic frontier. First, let's set the stage by understanding the core problem these therapies are trying to solve. An erection is a complex interplay of your vascular, hormonal, and neurological systems. For a huge number of men, the primary culprit behind erectile dysfunction is something called endothelial dysfunction. That's a medical term for when the lining of your blood vessels isn't working properly, leading to a reduced availability of a critical molecule, nitric oxide, or NO. Nitric oxide is the master key that unlocks an erection. It signals the smooth muscles in the penis to relax, allowing blood to rush in. When NO is in short supply, that process fails. This is often made worse by oxidative stress from common risk factors like hypertension, diabetes, and cardiovascular disease. The first-line pills for ED, the PDE5 inhibitors, are brilliant at helping your body make the most of the nitric oxide it already has, but they don't create more of it. This is where the growing interest in peptides and amino acids comes in. These are molecules that can directly participate in the metabolic pathways that control both neurological signals from the brain and, most importantly, the production of nitric oxide in the blood vessels. The rationale for using an IV is to deliver these powerful agents directly into your bloodstream, bypassing the digestive system and the liver's first-pass metabolism, which can often break them down before they have a chance to work. This ensures a more rapid and efficient therapeutic effect. So let's talk about the specific molecules being studied. The first is a peptide called PT141, also known by its brand name, bremelanotide. Unlike any other ED treatment, PT141 works directly on your central nervous system. It's a melanocortin receptor agonist, which means it activates specific receptors in the hypothalamus of your brain, an area heavily involved in sexual function. In fact, PT141 is already FDA approved under the name Vyleesi for treating hypoactive sexual desire disorder in women. For men, the research is very promising. One key clinical trial looked at men with moderate to severe ED who were unresponsive to sildenafil. In this difficult-to-treat group, a subcutaneous injection of PT141 produced significant, rigid erections lasting over 40 minutes on average, compared to just 6 minutes for a placebo.
And because it works on the brain, not the blood vessels, studies have shown no hypotensive events, making it a potentially viable option for men who are on nitrate medications.
Next is a fascinating peptide called PNPP-19. This is a synthetic, non-toxic peptide that was designed from a molecule found in the venom of the Brazilian armed spider. Scientists isolated the component of the toxin responsible for causing erections and re-engineered it into a safe therapeutic peptide. PNPP-19 works by directly activating the nitric oxide pathway, helping the cavernous smooth muscles to relax. So far, the research is limited to animal models, but the results are impressive. In hypertensive and diabetic mice, both intravenous and even topical application of PNPP-19 was able to normalize erectile function. And interestingly, the studies showed that the peptide has a natural affinity for localizing in the penis and testicles, concentrating its effects exactly where they're needed. While human trials are still required, it represents a powerful new way to target the NO pathway. Beyond these advanced peptides, there's also tremendous interest in two fundamental amino acids, L-arginine and L-citrulline. Amino acids are the basic building blocks of proteins, but these two are special because they are the direct precursors your body uses to synthesize nitric oxide. More L-arginine means more raw material for the NO factory. A meta-analysis of 10 randomized controlled trials confirmed that oral L-arginine supplements significantly improved erectile function in men with mild to moderate ED. However, when you take L-arginine as a pill, it's poorly absorbed and heavily broken down by the liver. This is where its partner, L-citrulline, comes in. L-citrulline is absorbed much more readily, and it bypasses the liver. Once in your system, your body converts L-citrulline into L-arginine, effectively creating a time-release mechanism for the crucial NO precursor. One study found that 50% of men with mild ED who took an oral L-citrulline supplement saw their erection hardness score improve to normal, compared to just 8% on placebo. The evidence for these amino acids is strong, and the logical next step being explored is using an IV to deliver them directly, avoiding the breakdown of oral administration and potentially producing an even more robust effect. So, with all this promise, why isn't this a standard treatment yet? The primary reason is the lack of large-scale human clinical trials, especially for the intravenous route. While the underlying science is sound, we still need rigorous studies to establish the optimal dosing regimens, long-term safety profiles, and potential side effects of IV administration. The current IV amino acid solutions on the market are designed for parenteral nutrition in hospitals. They are not formulated with the high concentrations of L-arginine and L-citrulline that would likely be needed to treat ED. The future of ED treatment is moving toward a personalized, multimodal model. The rise of IV therapy clinics reflects a public interest in proactive, personalized health solutions. In the context of urology, this could mean a future where we test a patient's specific amino acid levels and then design a tailored IV infusion to correct those deficiencies. We might also see these IV therapies used in combination with other treatments. For example, using an IV infusion of L-arginine and L-citrulline could help to restore the foundational health of the endothelium, potentially making a patient who was previously unresponsive to a PDE5 inhibitor pill become a responder. In conclusion, intravenous peptides and amino acids represent one of the most exciting new avenues in the treatment of erectile dysfunction. They offer mechanisms of action that are completely distinct from our current medications. Whether by activating the brain's sexual centers with PT141 or by providing the fundamental building blocks for nitric oxide production with L-arginine and L-citrulline, these therapies aim to treat the underlying cause, not just the symptom. While we have a lot more research to do before this becomes a mainstream therapy, it signals a significant shift in how we think about ED, moving away from a one-size-fits-all pill and toward a future of truly personalized restorative medicine.
यह वीडियो ग्लोबल मेंस वेलनेस द्वारा प्रस्तुत किया गया है, जो आपका 24/7 एआई स्वास्थ्य विशेषज्ञ है। न कोई कोपे, न प्रतीक्षालय और न ही असहज बातचीत। बस जब भी आपको जरूरत हो, वास्तविक उत्तर पाएं। globalmenswellness.com पर जाएं, इसे मुफ्त में आजमाएं और आज ही अपना ऑन डिमांड कंसियज स्तर का वेलनेस विशेषज्ञ प्राप्त करें।